Hello, my people. Welcome to Redoctoring. This is the podcast that allows you to be a different kind of doctor. I'm your host, Dr. Diane, and today I have another wonderful guest with us. This is Dr. Amy. Dr. Amy is a health communicator online. And I must preface this episode by saying that I have been following her since I was a medical student. She was like the medical influencer to so many people. So it's such an honor to have you on my platform.
That's so nice.
Yes. No, please introduce yourself to people who might not know you, people who might just come across you for the first time.
Sure. Thanks, Diane, for having me on your podcast. I think it's always good to share the word about what's out there, not necessarily just the traditional pathway in medicine. So, as Diane has mentioned, I'm Dr. Amy Collyer. I'm a health communicator online, but that's sort of just a side hobby. At the moment, I have a portfolio career, so I work part-time still as a medical officer in emergency medicine, but my main job is I'm a public health practitioner. I'm on a grant in the Western Cape called the Scaling Use of Data Grant. It's largely around the intersection of using data to drive decision making at the facility and sub-district and district level. And when you use your data, you can drive decisions and you can see if your programs are working or not working. So we look for changes in metrics in health indicators, and we are specifically focusing on infectious diseases. So my real job is a lot of data analysis and policy implementation and stakeholder engagement and that sort of work. And the two are very different, so it's an interesting balance to hold. I hope that gives a good summary of where I'm at the moment.
I'm excited to dissect a lot of aspects of your career. I think it's so exciting to have a portfolio career, but we'll chat more about that later. For now, let's start with how did you find yourself in medicine?
Okay, let's go all the way back. Since I can remember, have wanted to be a doctor since I was small. Obviously, as you do, as you grow older, you're going through adolescence. I had doubts and I had other interests that I was thinking about, particularly in the arts. And it was always this, should I do like a science medicine pathway or should I go into an arts pathway? I entered medicine eventually, and here I am. So it has been since the longest time something that I have wanted to do, probably since I was less than 5 years old.
Wow. Did you feel like you had also family pressure to enter into medicine, or did they give you the freedom to actually choose between arts and medicine? Because both careers are quite far apart.
Yes, they are quite far apart. I had a little bit of family guidance, but I won't say that I was pressured by anyone. Of course, different people in my family had vested interests. So I had one or two members of the family who thought, medicine is a bit like too hectic and there's none of your sort of arts interests in there, and are you going to enjoy it? Are you going to be able to get through? But largely I was just encouraged to go down the path that made the most sense to me. But that's also tough because at 18 years old, how do you know? I think a lot of us enter medicine sort of straight after school, less so we have mature students. But yes, a lot of us at the age of 18, we don't really know what we want or what would be right for us, and that can play a role.
Yes, I think it just ties into the conversation that at 18, you're figuring a lot of things out. You're figuring a lot out, and you hear two different stories, the people who regret the decision that they made, but the people who are okay with it. And that's why I think it's very important to just redefine careers and also your job, because there is a lot of ways that you can remix the choice that you made at 18, far beyond.
Yes, of course. I mean, I think we'll get into it a bit more, but I was already struggling a bit in my third year of medicine, and I started thinking, is there more for me? I feel like this is, there's something here, but there's also something more. And it wasn't until like 3 years after community service that I started getting interested in public health and started to consider what a pivot would look like. So we can definitely at any stage of the way redefine what the career looks like. And I think there's a lot of us that are becoming increasingly interested in different ways of doctoring, because
Mm,
of, the work environment that's so tough, the hours, the pressure, the lack of jobs, and then also the changing landscape that is bringing a lot of different opportunities as well.
mm. I love the conversation. I love it. I love it quite a lot. You mentioned that in medical school you struggled in your third year. Was it mental health problems? Was it just the workload? What was happening?
To be fair, I can't remember explicitly, but I really strongly felt like I don't know if this is right for me. And I was looking at all these different arts programs, and I was thinking of jumping from medicine out into the arts. And something inside me said, no, no, just continue. And my mum also said, why don't you just get your medical degree and then make your decision? And I did, and recommitting to medicine at that point was very important for me. Then I started doing a lot better. Started to feel like I was managing things better. And as we moved out of the sort of lecturing environment into the hospital environment, I also started to do better academically and mentally. So yes, I can't remember. It was probably a lot of different factors at play, but this constant tension of there's other skills that I have that are not being met in the medical field and other interests, and also there's something bigger that I need to do, but I couldn't really explain at that time what it was.
Sure, that's actually so profound. I to experience that, but in my second year. I think after first year, maybe second or third year, medicine just becomes a lot more realer. And I also heard the same sentiment shared by a previous guest. She mentioned that she also started feeling like she wanted something more. How do you think one should navigate feeling that as a medical student? Because I know it's feeling like a lot of people have that, but not a lot of people speak about it.
Um, I think it really depends on the person, and a lot of personal awareness and digging down into what is it that's missing from this needs to happen. It's going to be very contextually different depending on who you speak to. It took me a long time, and I've only just realized it having arrived. I'm now in this public health job for my second year, and it's only now where I realize that I have design thinking and I have systems thinking that is not necessarily being used in a one-on-one sort of medical space. And I always thought it was, or because I'm artistic, I need to go and be an artist. But it wasn't that. It's only now I've realized that, yes, I'm artistic, but I actually have design like thinking. It's a whole topic on its own. And that wasn't being met in that job. And now it is in this job. And I finally realized. So there's like a lot of personal digging that needs to happen to see what is missing. And underneath that, I don't know if you've heard of the 5 whys, but it's you
Mm-mm.
should ask yourself why 5 times to get to the root of something. So if you're trying to say medicine is not for me, why is it not for me? Or it's something that's missing, or it's something that's not right about this specific medical school or this job or this these people that I'm working with. And then below that, why is that a problem? Then below that, why is that a problem? And you'll get to sort of a
Mm.
root that is going to be different depending on every single person. And you might get to your root and decide, oh, there's actually a totally different career here for me. Maybe I was this whole time meant to be a data scientist, and I went into medicine because of family pressure, and now I must actually pivot out and go and do that? Or is it that I have a skill that's not being met that I could start bringing into my current role without having to move? Just start speaking to your consultant or your managers in the hospital and start setting up a little quality improvement project on the side if that's what you feel that's going to get that other part of you met. Or is it that an upskilling that needs to happen, and side hobbies that need to be started? It really depends on the person.
Love that. I'm going to actually Google that, the 5 whys. I need to
Yeah,
dissect it and find some more out. I think it's even something that you can put to anything in life, anything that you're questioning. Quite interesting.
yeah, yeah, it
Did you
helps a lot.
have did you have a deeper why for medicine? Some people feel like medicine is their calling or their passion. Did you have any deep reasoning that kept you strong in the tough days?
I have an inherent deep need to be a helper, to be in a helping role. And I have, through medical training and research training, gained quite a passion for using evidence to make decisions, whether that's for my patient in front of me or for a program or something else at a high level. And yeah, I have a quite a moral, strong moral compass for helping that can only really be met in sort of this healthcare role. I mean, I haven't worked in any other industries really, but I think that kept me strong. Yeah, I think that combination. And after medicine, every time that I wondered, I need a break from medicine, or I want to do something else, or when I'm moving into public health, am I dropping away from clinical medicine completely, or am I going to look at sort of a portfolio career? And what kept me going is actually the oath taking that we took at the end of medicine, that it keeps me strong on my pathway. I hope that
Wow.
answers your question.
No, that's beautiful. I even see it in your social media, how you communicate. It's very much not from a point of view of I'm trying to get views. It really feels like you want to help and communicate. So it does translate.
That's good to
Oh,
hear. That's the goal.
keep it up. Keep it up. You're doing well. Um, After your community service, you went into ED. Was that something that you started
Mm.
having a liking towards in your internship and community service? How did you find yourself in the space?
Yeah, so in community service, I worked in quite a very deep rural hospital in Mpumalanga. And for the last sort of 6 months of my community service, I was stationed in the emergency department, and we had sort of two medical officers that left us midway through the year, and we didn't really have strong sort of senior support in the emergency department. And I just kind of midway through my community service had to up level and sort of manage that emergency department. And I think when I finished community service, I went traveling for a bit. And when I was coming back to South Africa and I needed to start working again, it just felt like the most recent exposure, and where I still had skills and I still had courses that were up to date. And in the private sector, they are quite stickly with having your up to date trauma, cardiovascular life support, and all those courses. So it was just easy for me. I had the courses, I had the recent exposure, and then I could just go into private emergency medicine just because I needed a job. And then the pandemic hit at some point, and it was very difficult to get a job. And so I kind of just stayed where I was longer than I thought I would. But I think it helped me develop a lot of skills that help now. I think in private practice, you have to you're not just a doctor, but you're also like a hospitality person, and you have to get really good with managing things in sort of a professional and corporate way. And a lot of public health jobs are in the sort of NGO space, and how you're expected to report, etc., is all corporate based, even if you're seconded into a government structure. So, yes, the way that I built relationships at that time and the skills that I learned have also served me well.
There's something about privatized healthcare that's not just you being a health professional, you are in hospitality, like you said, and customer service um, dynamic. There's a customer service dynamic because patients are a lot more, they advocate for themselves a lot more. They do. How did you balance being an ED? A lot of people feel a toll on their mental health. A lot of people feel um, like it's quite a lot on on themselves. Is there anything that you did to preserve your mind? Is there anything that you did to make sure that you still stayed sane in such a hectic environment?
Um, Yeah, quite a few things. I think it helped when I moved over to private emergency medicine that I could kind of choose when I wanted to work the night shift, and it didn't have to be, as regular and incessant as when I was in the States. And then that changed when I went back to States emergency medicine. But yes, I developed some habits that really helped. I would say one of the main things was post coming off at night, I would want to go and watch sort of the sunrise coming up by the ocean because I lived in Durban. And just having those moments before I went straight back home to sleep was really important for me to realize, okay, I haven't been inside this building with no windows and just seeing emergencies all night, to go straight home. There is actually life happening out there, and there's people going about their day. A point of regularly exercising. That's been really important for my mental health, and to remember that we're all busy in medicine. We are always tired. If we use this as an excuse to stop exercising and to not prioritize it, then we'll never do it, and we'll never get the benefits that come with it, which is, endorphins and fitness and confidence and all of that. So those are the main things, just taking a sort of a breather, prioritizing my exercise, and then obviously things like nutrition.
The sunrise definitely translates into just go outside and touch grass. Like I mentioned to you off camera, I'm in the space where I'm navigating locums and all. And you mentioned how things are different in the private space with regards to ED. I've also felt that as well, that in private, there's different systems even in place that can take care of you as a doctor. So it's important to, I think if someone is even feeling like public healthcare is not for them, maybe take some time and be in the private sector because maybe because there's other systems in place and other um like you said you were able to choose your night shifts, maybe that's even something that can help you with regards to feeling better in medicine. It's
Sure, but I
interesting.
do think, yeah, it's a temporary space. I do know there are doctors who work long term in the private sector emergency space. It's the only sort of department that you can work in um, for long term because, outside of being a GP, you can work in the emergency department, but you can't work in any other sort of space. Um, but yes, after a time, it gets to you that there's no sort of academic rigor, there's no sort of team-based care. It's very isolated, and there's no sort of career progression. You just remain at the same level. I think that eventually gets to a lot of people, and it, if anything, is it's a stopgap, and private in itself is becoming very oversaturated. And I think we need to start thinking of all the sort of different opportunities. It was very useful for me in when I didn't have a job and I didn't know what I wanted to do. And then I started studying my master's in public health. The time that it gave me to start getting into another degree was very useful. But unless there's a worst case scenario, I wouldn't go back.
Interesting, interesting. You mentioned previously that it took you 3 years post-ComServe to find yourself in the public health space. Can you tell us how did that happen? How was your trajectory into that?
So I'll just make a clarification that it was 3 years after community service when I decided to start studying public health, but it was
Okay.
8 years after public health, after community service, before I actually got this public health job. So I hope that helps people understand that it might be a bit of a different um, it might be different compared to like your traditional route in going into different specialist careers. Um, a lot of people, especially that I know here in the Western Cape, that are registrars in public health, they have done a lot of different other jobs and are coming to training sort of in their late 30s to 40s. So, yeah, public health does work a bit differently in that way. I think it takes people a lot of time to realize, firstly, what it is and if it's for them. And it's quite a broad field. There's so much that you can do, and it can almost feel overwhelming. And it can take some time to realize, where you fit in that. And accruing the public health competencies and skills takes a lot of time. And I only really could do this like long after my community service. I couldn't have imagined trying to learn data analysis and deep statistics and epidemiology and all of these subjects while I was still a junior doctor. Just even if I'd been interested, I don't think I would have had the time to build the right skills and competencies. So, yes, I think it just eventually came to me because I was starting to communicate health during the pandemic, and I realized that I wanted to build on that. And then I found the master in public health, and I was still studying my master in public health while working in private in emergency departments. And then I jumped to a state emergency medicine. I worked in Ngwelazana in Zululand for a while. And then I only started making the connections that, okay, I'm ready to leave full-time medicine. Um, and I can see through the time that I'd spent tracking different companies and organizations on LinkedIn and chatting to different people, I could see that there's something for me. And I was nearing the sort of end of my coursework and my master's. And then it became apparent that it was now time to jump. And I had built up the right skills and competencies to make that jump.
That's so interesting. I think a lot of times people feel like their career trajectory has to happen instantly. I was speaking to a friend who's interested in public health, and she is quite upset that it's not happening as quickly as she wants it to. So it's so encouraging to hear that your journey has been 8 years in the making, and that's actually normal. That's quite normal for the space.
Yes, and I might actually say I've gotten the opportunity to sit in some quite high level meetings recently, and I'm often like the youngest person in the room by far. So it's taken me sort of 8 years post community service, but I'm still like 10 to 15 to 20 years younger than a lot of people in the sort of high level boardrooms. And that can be quite intimidating. So, yes, this space does work differently. Firstly, there's a lot less specialist training roles for public health in the country. I'm not in that pathway, at least yet. I've garnered the Master in Public Health through the science route and then managed to get an equivocal job in the NGO space, and then I'm seconded into the government. So that's one sort of way to go about it. But yes, it doesn't work sort of in the linear, quick way that often happens with other roles in medicine.
It's interesting, quite interesting. You mentioned that you are doing your master's. How did you get into that?
I've been curious about studying a UK-based program for a while, mostly because they offered a lot of subjects that I couldn't find through the South African programs. For example, health decision science, and at the time when I was choosing, I couldn't find a full master's with economic modules or explicit health promotion modules. So I just decided to take the leap and applied and got in, and that's that.
Wow. So you're a long distance learning learner. Do you ever have to
Yes.
go that side as well? Or everything is online based?
Everything is online. There is an option to do blended learning if you'd like to at some point. I never did it because I could never take out, I think it's a 6-week period where you can go and study some of the modules in person, but I could never take the time out, and it ended up being more expensive as opposed to just staying at home and doing all the modules here. But yes, that is an option.
Okay, first, I think let's first dissect your portfolio career. Your portfolio career is half in ED, half in public health. That's so interesting to hear. A lot of people feel like you have to pick one or the other. How did you come to the realization that you were someone who needed both and that you could make both of them work?
So I wouldn't say it's half-half. I would say it's 20%, 80%. So 20% ED now, 80% public health, if I just look at how my week is split. I spent a long time in emergency medicine, all those years, like 6 years or so, and I built up a lot of skills, and it came to a point where before I jumped into public health, a lot of people were mentioning to me, why don't you apply for to train to become a consultant in emergency medicine? And it just didn't feel right. So I didn't want to lose all those skills, and I really like being in the sort of ED space because I feel like it's the space that shows you what is failing in your society, what programs are failing, what inequities exist, and it all comes together in your ED space. And as someone working in public health, I always want to stay in touch with that. I want to stay in touch with what are the people on the ground really experiencing. And I didn't want to lose my clinical skills. So I felt like I'd spent long enough in emergency medicine that I could do it part-time without sort of being a risky doctor, if that makes sense. And also work in a space where I do have consultant support. So I fully acknowledge my limitations. I got to a point where I accrued a lot of skills, but I'm still not the best emergency doctor, and I can work independently but still need to have some upper level support. And I think that combination was important, is why I can work a bit of the time there and be helpful rather than like a hindrance in the space. And public health is very different to clinical medicine. So you spend a lot of your time on the computer, sort of on emails, on meetings, analyzing data. You can spend hours with just one data set, sort of repivoting, making different graphs, trying to look at associations, trying to make recommendations from what you're seeing in the data. Some of the time is spent on site visits, and some in high-level sort of in-person workshops. But a lot of that, it's so different, and it feels so far removed from the patients on the ground, even though what you're doing is for the population. I wanted to sort of keep my hand in emergency medicine as well. I don't think it'd be for everyone because it is quite stressful to keep having to switch your brain backwards and forwards and to organize your week in a way that you can still get everything that you were meant to do in 5 days for the public health side into 4 days. But yes, I think there will be a subset of people that would like to try and balance. And I think it's possible. And it just depends on what arrangements you have where you're working. And everyone has to sort of be on board with you doing that.
Mm. You mentioned that one of the challenges that you face is having to fit in the whole week's worth of work for public health into 4 days. Are there any other challenges that you've faced with regards to navigating and tackling your portfolio career?
So, something that's interesting is in medicine, I feel like, especially when you've practiced for a number of years, you get to a point where you might have some pre shift anxiety, but for the most part, you'll do your work and you'll either refer or discharge your patients, and then you will leave your shift, and that's that. And you, unless you've had like a major case that sort of is a moral injury to you, you largely won't think about work after you've left work. And with public health, because you'll often be balancing a lot of different aspects of projects or multiple projects at once, and it's always in this constant state of never being finished, because public health work takes months, if not years, to result in some kind of impact. And there's a lot of moving parts. My mind has been blown with how many people you have to connect with, both at a different vertical levels of the government and horizontally across to different sectors and NGOs. And this sort of feeling of it's never finished, and have I engaged the right people, and have I sent the right emails, and have I steered my meetings in the correct way that actually steers the project in the correct way, that can sit with you. And you I actually often work after hours. It's not a good practice, but yeah, I'm often still finishing things and thinking about things long into the night, because it just feels like it's on such a different level and it impacts so many people at once that you really want to be sure of what you're doing. So I think that's a stress that I'm still navigating, especially being in my second year in the space, is how to not work at night, how to close off work from personal life. I think this is quite a difficult thing.
Mm. I totally hear you. Work-life balance is it's something we're all working on, and it's a continuous improvement project. I think especially for doctors.
Yeah,
Um,
yeah, difficult
with
space.
regards to the public health side, it's one of the most popular non-clinical spaces for doctors to want to pivot into. What skill sets have you noticed that you have to have in order to succeed in the space? Whether you noticed it from your colleagues or the people higher up, or even in yourself that you are developing.
It's a good question. So one of the big things is being able to work with data. So whether you are in the research side of public health or you're in the management side of public health, where you're actually working at like managing a facility or a hospital, or you're in the NGO space and you're like a project manager on a specific thing, for example, an HIV project to increase PrEP services, or you're in sort of policy implementation, wherever you are in public health, it's quite a broad range of things. You have to be good with being able to analyze a large amount of data across different types of data sets in order to make a decision. So whether that's making a decision for your program and the patients, or your facility, or your research space, this is a key skill. And um, a lot of the public health, whether you're doing a certificate or a diploma or a degree, you will start off with epidemiology, so basics into more advanced epidemiology and statistics, even moving into advanced statistics, and then the overlap where you might have statistical methods in epidemiology. And then this parallels with needing to become versed on using different data tools like Excel or Power BI or any of the others. And then from there, being able to visualize your data in a meaningful way. So this is quite a core thing that goes together, is both the data analysis and understanding what it means, and visualizing it so that you can present it to people and make decisions. And then the other core thing is public health overlaps a lot with politics in different spaces, and you have to be quite good with people and managing relationships. And I think a key thing in public health is you start convening meetings to make decisions on different things, and being able to know your people and having those good relationships with who's in the room, and being able to steer your meetings in a way that you can actually drive a meaningful decision or outcome is very important. Um, yeah, those are sort of the big things.
Wow. No, it sounds like there's a lot of moving parts to public health, actually.
A lot. Yeah.
You mentioned also that you work with government and you also you see a lot of data. Whenever people mention data, I always think about numbers and ones and zeros, the binary codes. When you interpret the data, is it like from things of studies, or what's the data that you guys interact with a lot?
Yeah, so it depends what space you're working in. It's important to always understand from the literature when you're joining a project, what does the literature say? For example, if I'm going to now work on a policy implementation of increasing TB testing in a specific region, for example, then I'd like to go into the project looking at the literature, knowing what are the TB, you know, what are the TB metrics in this region. So you can get that sort of from any studies that have been done, but then your region will be collecting data in different ways. Depends where you work in South Africa. We have a lot of different systems. We have hospital level systems. We have primary healthcare level systems for capturing data on specific diseases, especially in sort of an aggregate way. It's quite novel to have sort of the line listing data available down to the facility level across regions. In the Western Cape, we have the Provincial Health Data Centre that is merging a lot of the different data sets from the hospital and from the primary healthcare and from NHLS and other various sources. And then they get all the source data, they clean it, and they repackage it into reports and dashboards that can be used by facilities and health workers to make decisions. I'm not aware of this happening anywhere else in South Africa yet. It would be the dream to have a sort of a central data center for the whole country as we move towards needing an electronic health record. But yes, your data sources are prolific, and that's a challenge in its own, is how to look at different data across different sources and know what data is meaningful, what's quality data, what is it trying to show you. We're often over collecting different sort of data metrics and not making sense of them. And then under collecting in other areas. So it's a big space for work to be done. There's a lot of opportunities coming up in sort of the digital health and data space, but having, again, those core competencies around data analysis, stats and epidemiology, and then again, visualization, and starting to become aware of the different digital health platforms. We have Gen AI now, and we have agentic AI that's emerging. So a lot of the public health space is starting to bring different aspects of this in, and pilot studies are starting. So if anyone's interested, that is a space for opportunity. But again, a lot of core skills need to be built in order to work in that space meaningfully.
Hmm. Wow. It's interesting to see how with the boom in AI and how technology is revolutionizing, how it's also impacting and also growing the space that is healthcare and medicine. Quite interesting. If anyone is
Yeah.
keen to explore public health a bit more, how would you advise them to satisfy this curiosity of theirs?
Good question. So it depends where you are in your journey. I would say juniors should maybe start building a LinkedIn profile. There's a lot of opinions around LinkedIn, but I got my last job through LinkedIn. And you can really start to follow different organizations, different research companies, different individuals with thought pieces, and you can start learning about what public health is, because it's a really broad field, and there's a lot of different spaces that one can move into. So that would be the first thing. And then there's a lot of blogs out there. A lot of the universities have a lot of information that go along with their programs that you can read and decide if you want to study public health. I think that's where it starts, is look for the thought leaders in public health, look for the organizations that are publishing on their work, and have a look and see if public health studies are for you. I actually did write a blog piece for my university about why I consider studying public health. It's linked in my bio on my Instagram, and it's somewhere on my LinkedIn. But yeah, there's lots out there.
I'll find the link, and I'll actually link it into the description for this episode. I think it would be very helpful for someone to read it.
Okay, cool, thanks.
You have blended communication and creativity in the online space as a health communicator. What is your take on doctors sharing information online?
This is a big, loaded question. I think that it's a very important space for doctors to be in. I've just recently watched a health misinformation workshop event, and it's quite clear that people are not very interested in getting their health information from politicians and the media, and are more interested in getting it, from the nurses and the doctors that are online. And in the South African space, we don't have enough health communicators who are really taking the sort of difficult to understand studies and simplifying it down to what the public can understand and communicating that out. We don't have enough people in the space doing the work, and we know that there's a lot of misinformation on all the different platforms, and it's needed. But at the same time, I'm seeing increasingly we have a lot of doctors who are more interested in sort of the likes and the engagement and all the brand deals that come with it. It's a very lucrative space, and I've personally had a lot of qualms with people who are sharing false claims, and then being invited to these big corporate events and obviously getting a good paycheck to promote different products. And so they are online and they have the veil of authority in being medical, and then communicating something to the public that either they don't need or might create harm. And I think this is becoming increasingly a problem. And in South Africa, as opposed to other countries like Australia, we don't actually have regulation of social media of our clinicians. So, for example, in other countries, their clinicians are actually monitored for what they post on their sort of professional profiles, and sharing misleading claims can actually be considered a type of malpractice, and they're actually held accountable. And I think this is important. We don't have this in South Africa, so unfortunately, we do have doctors who take to social media, perhaps with good intentions at first, but then are seduced by the money that comes with influencing. And it's really a fine line between engaging the public and sharing meaningful communication and actually misleading the public. And then there's no accountability for it in our space. So if you have the interest, I'd suggest doing some, even if they are short courses in health communication. I did this at some point, and sort of really understanding the ethics around what is good practices on social media as a clinician, because we, outside of having formal accountability, have to hold ourselves to a good standard. And that can be very hard to do, especially when there are different factors at play.
Lots of factors, lots of factors. I think about how social media can swallow people, make you work for the algorithm instead of working for the people that you're trying to serve. How have you been able to not necessarily defeat that, but to fight against that in your own content? Like you put the people first and you ignore the algorithm. How have you been able to manage that?
I think it comes down to, firstly, what I've said before about taking the oath that I took in 2015 when I finished my medical degree. I take that very seriously. And I have a strong moral compass for this, and my inherent need to help rather than harm is quite strong. I have a job which pays me enough, and I don't feel like I need to use social media as a form of income. And I think this plays a huge role. I know there are not, this is not the case for everyone, and I wouldn't like to maybe be hard line about it, because I think some people do need to rely on social media for financial compensation, especially with the work involved in health communication. Um, but yes, I think for me, it's been a big thing that I don't need social media, and I've maintained it as a hobby since I started it, and it really just fulfills sort of a creative need that I have.
Mm, no, definitely. I think there's a big conversation in life about finding what your enough is. And if you find that in whatever you do, it stops you from going above and beyond and being proudful and then wanting to conquer everything. So I think it is a very valid point that you have made. With regards to showing up and you have people who troll and also hate on your content. How do you navigate that as a health professional? You don't want to, yes, you are in the position of authority, but you also want to, as a human being, engage with other people and maybe even try to educate them through maybe their misunderstandings. How have you found that?
I think it's important to become versed on your different type of trolls. So you will literally have human trolls, but then a lot of our trolls online are actually bots, um, and sort of automated. And you can, maybe with a bit of digging and clicking into accounts and having a look at who's commented, you can start differentiating if this is real or not. And if it's valid criticism that needs to be responded to, for example, if a fellow professional says that something that I've said is wrong and they ask me for citations and we start getting into a bit of a scientific debate, I think that's important for us holding each other accountable. But then obviously there's trolling just for the sake of trolling, or trolling for money. A lot of the disinformation architecture in the algorithms is actually just to drive profits. So it's important to differentiate them and to decide when this is really just trolling, it's not in good faith, it's not going to generate any important debate, then just to delete the comment, don't engage, and block. That's the main thing, is to make this distinction.
Which is a very important distinction to make, quite important. If someone is thinking about being a doctor online and sharing whatever aspect of medicine they want to share about, how would you advise them to go about it? I know you said you did a course in health communication. Um, how would you advise someone to, become a health educator online if they feel the curiosity towards that?
Yeah, so I mean, there's different short courses, even for free, that you can do just to learn about what good practices are in terms of communicating health online. And then start following people that you look up to, and you can see that are well supported and are quite evidence based. And you'll quickly learn through the debates that other accounts have with each other. Who's even like sort of a big account that's still sharing a bit of misinformation here and there. I think it'd be good to have a period where you are just sort of scoping your platform, because again, the platforms are all different. So decide which platform you want to be on. If you want to be on multiple platforms, start learning what others are doing. Get a sort of course to learn best practices, and then just experiment with different sort of formats. It's changing all the time. And to sort of navigate confidence in filming and creating videos and deciding if you want to partner with somebody else and collaborate, because that can help sort of reduce the workload, especially if it's for free. People can divide, if they're making a reel, you can decide who's going to write the script, who's going to put it all together, who's going to add the captions. Yeah, those are some things to think about.
I think as we are moving into a space where everything is digital, it's important for there to also be good influencers online. And I believe that it is important for us as healthcare workers to also be in the space, because that's where the public is. But I do agree that measures need to be implemented in order to keep everyone safe in that space. You also mentioned that after your community service, you took a break. That is something that a lot of people, unfortunately, in the new reality of medicine in South Africa are doing. So I'd like us to talk about the unemployment crisis of doctors that is very prevalent. How would you advise someone to navigate this period?
This is so tough, Diane. This, unemployment of doctors has been something that's not new. It's something that has existed for a long time, and it's seemingly getting worse with the closing of posts, freezing of posts. I think the best thing is to just diversify. So diversify your applications. If you have the right skills to work in private, start applying to all the private emergency departments. Send your CV out for all the state posts you can find. Start upskilling and considering NGO work as a doctor. There are sort of different pathways that you can take. There are research consortiums that are always looking for junior doctors to start on the research journey. With all of it, you will have to consider sort of a pay drop. We get paid quite a lot as community service doctors, and especially in the unemployment space where you might have to move into private for the first time or move into research for the first time, you will inevitably experience a drop in pay because you'll be starting again sort of in a new industry and have to work your way up. But diversifying and being realistic about, am I really unemployed, or am I just vying for the kind of few jobs in Cape Town or the few jobs in like Joburg city centre? There's a lot of different jobs in different spaces, and don't underestimate the power of networking. You can network through LinkedIn, you can network through many conferences, virtual conferences. Just put yourself out there and become known. Statistically, if you put your CV out, 200 times as opposed to just 3 or 4 times, something will come eventually. It doesn't, this doesn't answer how difficult it is to experience unemployment, especially for a protracted period, and to try and navigate this time while potentially raising children and still having study debt and all of that. But the quicker that you get on to diversifying your applications and networking and making yourself known, I think is important. And then the other thing that I can say is to downscale financially where you can. Do you need to be driving the most expensive car, like straight out of internship community service? Do you need a very big house? Can you downscale to something that is reasonable, a reasonable car that's not too expensive, a smaller house, and sort of just decrease your debts? Because a lot of doctors kind of go gung-ho in the beginning and feel that they need to sort of show up in life and start investing in these things quite early. And I think downscaling is quite important.
I think a lot of people buy into the fact that because we study so hard and for so long, that when you start earning, this is the time to live your best life. But we forget that we're actually 20-something years old. and we're going to be alive until 70 or 80 something. So do we need to be driving the German car now in the 20s?
Yeah, it's true. It's
Oh,
true.
wow. Oh, wow. Wow. That's a conversation that I will tackle another day.
It's the things that people don't want to hear. Um, they don't want to hear how hard it is to really try and find a job. They don't want to hear how hard it is to give up comforts and luxuries and to face the realities. It's hard. So it's worth unpacking in another episode, I think, Diane.
Definitely, definitely. Also, when you spoke about lifestyle downgrade, I was talking to someone who was working in research, and I was so surprised to hear what they were actually making. Unfortunately, when you work in the government for 3 years, it pumps up your financial ego that this is how much you're worth. And then when you
Mm,
move into a different space, you actually eat humble pie because
mm.
you need to start again. And it's a new awakening that I realized. But yes, Amy, this has been an amazing conversation. Thank you so much for this. If people want to connect with you, ask you more about your journey, find out a bit more about your hot takes, where can they find you online?
Thanks, Diane. It's been a great conversation. Thank you for having me. So you can find my public health communication profile on Instagram. It's Dr. So Dr. Full stop Amy Amy Louise Louise. And then I would prefer to engage sort of on public health and career journeys and things like that on my LinkedIn. So just look for Amy Louise Collyer. My surname is Collyer.
Okay, thank you so much. Thank you, thank you, thank you. This has been Redoctoring, your permission to be a different kind of doctor, and signed by Dr. Diane. Goodbye.